Hello lovely people, welcome back to my channel. In today's video I'll be talking about Clomid versus Letrozole. I'll be sharing with you what is Clomid and what is Letrozole, and I'll share with you how it works to stimulate ovulation. I'll also talk about some of the side effects of Clomid and Letrozole, and of course talk about how effective they are in terms of stimulating ovulation. If you're new on here, my name is Nana. I'm a pharmacist and I talk all things women's health, and of course medication. If these are some of the things you're interested in, why don't you hit that subscribe button now and let's become family. What is Clomid and Letrozole? So Clomid and Letrozole are known to be fertility drugs that are normally prescribed to women who do not ovulate. So they are medication used to stimulate ovulation. So if you're a woman or a couple that is facing infertility, then you're likely have come across these drugs, or you're likely to be prescribed these drugs by either your gynecologist, your doctor, or your healthcare provider. So Clomid has been around for more than 30 years, whereas Letrozole is one of the newer drugs used in the fertility clinics. So Clomid and Letrozole work in different ways. Even though they both stimulate ovulation, they work in different ways and have different benefits and of course different side effects. Interesting factor is Letrozole is known to be an anti-cancer drug, so it's normally prescribed to postmenopausal women who have breast cancer. However, most fertility centers and some doctors tend to prescribe these as an off-label for treating infertility. Before we talk about which one is more effective, let's talk about how they work to help you, or how they work to help women ovulate. Before I start, I have a whole video on Clomid. If you haven't watched it, please do. You'll find out more about Clomid. So how Clomid stimulates ovulation is, it does this by tricking the brain to think that you have low estrogen levels. By doing so, there's more follicle stimulating hormones that are released. So these hormones will mature the eggs that are in your follicles, and of course hopefully one will be released for fertilization. Letrozole belongs to a group of drugs known as aromatase inhibitors. What they do is they lower estrogen production, resulting in a better regulation of your follicle stimulating hormone and of course your luteinizing hormone. By doing so, Letrozole helps develop the eggs and of course induce ovulation. So this is how Letrozole works. Now let's talk about how they are taken. So Clomid starting dose is 50 milligrams once a day, and it's normally started on day 2 of your menstrual cycle, and they're meant to be taken for 5 days. Whereas Letrozole starting dose is 2.5 milligrams, and again it is also started in day 2 or 3 of your menstrual cycle, and it's meant to be taken for 5 days. Letrozole and Clomid are oral medication. Let's move on and talk about the side effects of both drugs. So Clomid tends to have more side effects than Letrozole. Side effects are normally dose related. So what that means is the higher the dose of your Clomid, the more chances of you experiencing some of these side effects. So some of the common side effects with Clomid are, number one, hot flashes. So some people tend to experience hot flashes, especially in their face. Some people tend to experience breast tenderness. Some people also tend to experience menstrual irregularities. There have been bloating and headaches reported as well. One thing I will mention is that long-term use of Clomid do put you at risk of having ovarian cancer. Therefore, if you're someone that uses Clomid every month or per month, then it's worth speaking to your fertility doctor or your gynecologist about this, and then they'll be able to offer an alternative treatment. Letrozole side effects are mostly linked to the dose that you are likely to take. So the higher the dose of your Letrozole, the more chances of you experiencing some of these side effects. And again, everybody's different. So some of the side effects of Letrozole are GI disturbances. Some people also experience nausea, vomiting, and bone pain, and they may be at risk of developing osteoporosis and of course bone fracture. So again, as I said, it's all dose related. You are less likely to experience this. Some women also experience mood changes. Now let's talk about how effective these drugs are. There was a study conducted on letrozole. Letrozole were given to women who had PCOS. They found out that women who have PCOS are more likely to have ovulation and more likely to have live births and more likely to have positive pregnancy tests than Clomid. So this group of researchers that did the study on PCOS women also did study on women who were facing fertility problems. So they did find out from this study that women who were given Clomid and women who were given letrozole had similar results in terms of ovulation or in terms of live births or in terms of pregnancy. Or I would say both medications are very effective at stimulating ovulation. However effective they are depends on individuals' health and of course their circumstances. So it's worth speaking to your doctor or your gynecologist about these. They will be able to direct you, or they will be able to recommend which treatment is better for you. These drugs are the cheaper alternatives to other fertility treatments such as IVF. So it's always worth speaking to your doctor about these. Right guys, I will end this video here. If you find it very useful, why don't you give it a thumbs up? Don't forget to share, subscribe, and I shall see you all in my next video. Take care. Bye.